All right, everybody, so today we are looking at doing some PDO lifting threaders for Miss Deborah over here, our fabulous Miss Debbie. She's a little nervous. We've already numbed inside the mouth and a little bit on the outside, but I want you to put your head back. So Deborah's biggest concern here is that she wants to get rid of this. But for today, we're gonna do our marionettes and then our jowls. We'll pick these up here and then the jaws. So we're marking, we like to use our little Expo marker pen. And we are going to do the little thumb test and we do one of these, right? So we see that I like to see like right through here. So what we want to do is stay underneath this cheekbone because I really do like the way that her cheeks are formed right there. Then I'm going to drop one straight down to kind of take care of these jowls. Okay. Yep. And then this one right here, we're going to pull this one back. And let's do one of these. Okay. We like to keep everybody painless. Okay. So I'm just going to go ahead and numb just a little bit more. Right at our access points, we give a little pinch. You feel this? Mm-hmm. I want to get into that subdermal layer, okay? And it's more of like a not a push with the right hand, it's actually a pull. So we want to kind of feed the skin upwards. How you doing, Deborah? Mm-hmm. You're okay, right?
Yeah.
And we kind of feel where that tip is, right? So we know exactly where we're going. We stay in that plane. It's really important to stay in the correct plane. We take our time to make sure that we're guiding it down. There's lots of anatomy over here that we want to avoid any areas that are thinner, and there's like bone. And as we're going through, we're just kind of pulling up. And our patient's doing wonderfully, right? And we kind of extend it down. We go pretty much the length of the entire thread. And what we do here now is that we're gonna pull up. You can kind of feel that, like a little bit of that barb kind of catching. So we exaggerate the pull. And then when this comes out, you see there's a bit of a good lift right over here. My marker is going to town. How are you doing, Deborah? Okay?
Good.
Not bad, right? Okay. So now this next one, it's not going to be as long. But we're going to try to use the same access so we minimize the trauma. So again, we're going to lift it up. We're lifting her skin and pulling it up over the thread. We're not really using this right hand. Even though it is my dominant hand, we're actually using the least dominant hand. We're pulling down here. Okay. Now we're going to exaggerate this. Really give it a good lift. That one won't let go. We got it. Looks good. Mm-hmm. Still doing okay? Mm-hmm. Good. Great. side is all done. When we're doing this part here, when we're trimming it, we want to kind of pull everything up and stay really close. And what we're doing is trying to get these threads to kind of tuck back underneath into the skin. So we snip. Alright, so as you saw from the other side, I'm going to kind of get in here. Okay, and then we're going to lift up and over. You kind of want to feel for where we are. And then once we do, we just continue to kind of pull the skin up and over. Actually, Deborah has great anatomy for this. So we're right down here, we're going to go a little bit more. All right, and then we are going to exaggerate this upwards movement and pull up, kind of engage those barbs. Keep going, keep going, keep going, keep going. And then release it. Oh, geez. So you already see like a good pull right there, which is really nice. Now through the same cord, we're going to go down to here. Again, we don't have to go too far down on this one. It's the same size, but we don't, the distance isn't as great, so don't have too far to travel. But again, you see my left hand is actually doing all the work. The right hand's just guiding. It's not pushing or doing any of that. It's just kind of making sure it stays in the right direction. Deborah, are you nice and comfy?
Mm-hmm.
Good.
I am.
Again, we exaggerate that upwards pull. Didn't want to release it. There you go. All right. Good. I'll turn all the way to the end here. Can you just clean up? Yeah, thanks. You're just kind of easing it up. I feel like I'm doing a cooking show. Clean wipe for you.
Mm-hmm.
So you see the three, we did 1, 2, 3, and we exaggerate this, and you can kind of feel it catching on her skin as I do one of these. You can kind of feel that, right, Deb?
Mm-hmm.
Or you hear it, maybe? I don't know if you feel any of it, but so I'm kind of exaggerating, and any type of bruising is normal, especially for my patients, because I'm super strong because I've been hitting the gym. So it's a little excessive force. But it's important because it kind of keeps everything nice and tight. We want to snip as close as we can to the skin. We end up kind of hiding it underneath the skin because it kind of pulls up and over, just like so. As you see here, got a nice upward lift, and you can still feel little crunchies. And all that is the barb kind of catching right onto the skin. Over time, this is actually going to tighten up really nicely. And I'd like to actually bring you back and look at what we can do for some of these fine lines. Let's sit you up, okay?
Okay.
Let's show her in the mirror what you think. Here we go. Do you see a big difference? Any difference?
Oh yeah.
I know you can't talk right now. But this was lifted up a little bit. This is lifted back, right? Up. You notice like these kind of went away a little bit. So you do see some instant results, which is great, but the best results are yet to come in the future, because these collagen threads will dissolve in a few months, and actually that's when your own skin starts developing that collagen and stimulating that collagen growth, so you'll actually see much better results here in the next several months.
Gone.